This video will discuss about osteomyelitis. So the definition of osteomyelitis goes as it is the inflammation of the bone, inflammation of the medullary process of bone, medullary portion of bone and the marrow components may extend to include the periosteum, may extend to include the periosteum and the cortical part and cortical portion. Now, coming on to the predisposing factors, first of all is the virulence of microorganisms. Okay, and the second one is if the host has less immunity. So, the condition affecting host resistance. So this is diabetes mellitus, or it can be in AIDS, or it can be in autoimmune diseases. Also, if the patient is taking a steroid therapy. Now, coming on to the third point, which is the condition affecting the jaw vascularity. Conditions affecting the jaw vascularity, such as fibrous dysplasia, Paget's disease. Then we have radiation, osteoporosis. Now coming on to the etiology. Now etiology is due to four reasons. First of all is odontogenic infection because it is an inflammation. So it can also occur due to trauma, that is compound fractures, then facial soft tissue injury, and hematogenous spread. Now coming on to the pathogenesis. In pathogenesis, what happens is there is an acute inflammation. Now due to this acute inflammation, what will happen is we will have edema and pus formation. Now due to this, there will be an increase in the intermedullary pressure, due to which there will be a vascular collapse. Now, to this extent, the Haversian canal and the alveolar bone will be involved. Okay. Then there will be a periosteal elevation of pus accumulation. Periosteal elevation. Now, the periosteal elevation will occur because of the pus accumulation. Then there will be a decrease in the blood supply. Then the formation of draining fistulae. Now coming on to the microbiology. In microbiology, we will divide it into two, aerobic and anaerobic. For aerobic, it is Staphylococcus aureus and hemolytic streptococcus. Here, bacteroids and anaerobic streptococci. Now coming on to the classification. In classification, you have two types. One is suppurative and the another one is non-suppurative. Now in suppurative, we have acute osteomyelitis. Then we have chronic osteomyelitis. In chronic osteomyelitis, primary, secondary. Then we have juvenile osteomyelitis. In non-suppurative, we have secularizing osteomyelitis, diffuse and focal. Then we have proliferative. Then it is also called as Gar's osteomyelitis. Then we have osteoradionecrosis. Now in other we have syphilis actinomycotic, then tubercular, then due to chemical agent, due to electrocoagulation, osteomyelitis.